We're here at Dentistry for Health New York. At Dentistry for Health New York, your mouth is considered an ecosystem. It is believed here that the health of your whole body is connected to your teeth because your mouth is a barometer for your overall health. At Dentistry for Health New York, you are entering an office of true, sustainable, holistic dentistry. Sure, you can get whitening, straightening, and implants here, but you can get so much more information in your visit that you can actually save your life. Did you know that the first point of acid-alkaline breakdown begins in the mouth? With the special testing methods at Dentistry for Health New York, you can prevent disease and see underlying infections in cells and tissues. Test results like these may show, for example, stagnation in the lymph or the gut. Receive your own tailor-made home program and measure your success for your own sustainable health. When you're here, visit Thermography for Health New York with Tammy, a certified thermography technician. But Tammy also talks about her other programs here like Body Talk, a tapping technique, and her nutritional evaluation using bioenergetic testing. It's energy medicine. Do you have a safe kiss? Learn how to get one. Right now, let's hear from the man behind Dentistry for Health New York, Dr. Reed Winnick, who will briefly describe his practice, where state-of-the-art technology is used in combination with holistic care. Herbal and nutritional programs are implemented along with basic treatment. Also, Dentistry for Health New York treats infections, but if more serious issues are found through the testing, the patient is referred to another doctor among the group.
We know that they're getting a complete health physical, not just a tooth physical. You know, it's nice to have smiling, gleaming, clean teeth, and that's important to us also, but it goes much further than that. And one of the reasons that we've created Dentistry for Health New York, it's not just to help our patients, but it's to really start educating the dentist in the country about how important the mouth is to overall wellness, and then teach them this process and teach them how we can help them take their patients from a state of being okay to really a state of health.
Now it's imprinting.
And it's imprinting all of these.
Those frequencies, yeah.
Wow.
Yeah.
The patients who come here are not told what to do. They're educated, they're motivated, and they're inspired of what to do. And once they're on board, they're grateful, they're thankful, they refer their friends and family, because who wants to have their teeth drilled at a dental office? I don't. And luckily I found a better way, and I found somebody who explained to me what was causing my surgeries and my pain and all my other problems I was having. And by showing me that if you give the body what it needs and treat it like a sustainable world, because we're all part of this world anyhow, then the body can actually heal on its own. So I took the principles I learned to save my own life. I applied it to my wife and my kids, and then I decided that I wanted to change my entire practice, and instead of doing the aesthetics and all the cosmetic dentistry, I just stopped and I realized the best dentistry is no dentistry. The best dentistry is, well, let's save your teeth instead of extracting your teeth. Let me teach my patients that they don't need to wait for their teeth to decay, or they don't need to wait for their teeth to fall out of their mouth and then put an implant in. We can show you that there are sustainable ways of wellness that you can apply not only to your whole body but to your mouth. And then a great thing happens. The mouth heals and it prevents the need for all this extra dentistry. So if we take a patient and we look at their nutrition, we look at their amount of exercise, we look about how much water they drink, we look at their emotional state, we can put together this whole puzzle piece and determine where their weaknesses are. And the whole idea that their genetics controls their weakness is no longer a fact. It's been proven that you can actually change one's genetics. So patients say, well, I have soft teeth like my mom, so therefore I should have cavities, or I should be losing my teeth. That's not true. And we can show them how it's not true, and then we can reverse that. So if we understand that the body has its own innate ability to heal itself, and we just tweak things very easily, it's not very complicated, then everything changes. And then we get a healing cascade, and patients can have a very healthy mouth and not worry about having all this infection and toothaches and bone loss in the future. We have a specific process, and that process involves leadership, relationships, and creativity. And what we do is, through that leadership, we develop a relationship that builds confidence. Confidence that you know that you can save your teeth and sustain your health, but you're going to take your wellness and your own health to a higher level. So it's not like a cookbook. Everything is customized. Then we can help you build your overall wellness plan. We can also do this through our unique ability, where we communicate innovative ideas and concepts to you, the patient, and we find ways to motivate and inspire you to obtain this optimal health, and then we teach you how to sustain it. So the oral systemic connection is where the infections from bacteria in the mouth actually go through the blood system and affect other parts of the body. For instance, we know that the bacteria that's under the gums can go into the heart and affect the blood vessels around the heart. It can affect the lungs. It can affect a woman who's having a baby and cause preterm delivery. It can cause certain cancers. Even today they know that the inflammation that causes these diseases can also cause Alzheimer's disease. So the oral systemic connection is the understanding that the mouth and the body aren't separated by a neck, and that you have this overall connection. So if we see the mouth starting to break down, we know later on there's going to be disease someplace else in the body. So we can have the patient open the mouth and we can look inside. You can't open up your stomach and see what's happening. So the mouth really gives us a big clue of what's happening. However, you need to have certain tools or certain techniques to go and test for the infections. For instance, we would use a special parasite test of the mouth, and we take a culture under the gums to see what kind of bacteria could be actually going through the rest of the body. If a patient comes in, and let's say, for example, they have very loose teeth and they're losing the bone, well, you have to ask the question, what's causing this? Is it being caused by poor nutrition? Are they lacking vitamin D and coenzyme Q10, or are they having a certain reaction to their medication? Or are they eating foods that are too acidic? The other hand is, do they have the bacteria that's causing the bone to wear away? So you have to ask the question first, but then you have to just go and you have to test to see the viability of the mouth and the patient's medical history and the family history and their nutrition history to see what they're doing. So it's not just, well, someone's coming in and they have loose teeth, well, let's either extract them or clean them and hope for the best. No, there's a reason for something. You got to put the whole puzzle piece together. You have to be the detective and say, where's the missing link here? What's going on with this patient, who could be different than the patient next door, or could be different than the patient's spouse? Everyone has their own set of parameters that dictate their own health, and that needs to be looked at first. So we know that if a patient is a diabetic, and if they control the infection in the mouth, which has to be measured. You can't just look in the mouth and assume that the infection is gone. It must be measured. That's the biggest point. You know, if a child goes to a doctor and they have a sore throat, and the doctor looks at the tonsils and they are red and inflamed, the same way your gums are red and inflamed. But the doctor says, well, maybe he's got strep. Let's do a culture. Well, standard of care is to do the culture. In my practice, standard of care is to do a bacteria sample of the mouth to find out if this patient has a chronic infection. And if the chronic infection is there, it needs to be dealt with. If the chronic infection is not there and they're having a problem, then we need to look at their nutrition or their emotional state or whatever else might be needed that we figure out. For instance, for heart problems, if a patient has a history of having heart problems, well, let's even say they don't have a history of having heart problems. Let's say they have a family history. Let's say their father had a heart attack, and now the patient is concerned maybe they can have a heart attack. and they have no symptoms. And they go to their doctor and everything is great. But we can do our workup on them. We can ask them specific questions about their state of health. And we can look in the mouth and measure how much infection there is in the mouth. And we can then take it a step further because we have a special machine that we use that's been tested by the Mayo Clinic that actually looks at these cells called endothelial cells. And if those cells are in dysfunction, the research shows that a patient is going to be more prone to having a heart attack in 7 years. So, you know, it's my feeling that I'd rather prevent the patient from even getting a heart attack, because 50% of people who have a heart attack never make it to a cardiologist because they die from their first cardiac event. The mouth is a barometer for your overall wellness. Start with your mouth. Keep your mouth healthy. But if your mouth is falling apart, that's like a red flag telling you there's a problem going on elsewhere. Dental decay doesn't happen from sugar. It happens from the pH being too acidic. Every service we provide goes back to the mouth. Because we know, for instance, if a patient has sleep apnea, they're more prone to having heart disease. So if a patient can't breathe while they're sleeping, the heart can enlarge. So we have a specific test to measure if they're more prone to having a heart attack. One of the first questions we want to know is, are they snoring? If they snore, there's a likelihood they have sleep apnea, but maybe not. So one of the first machines we use is a device that actually it pushes sonar down the throat, and it measures the opening and the collapse of the throat. And we know if a patient would be more prone to having sleep apnea. When we deal with patients who have gum disease, and we know that there's an infection, well, we need to break up that infection. So we use ozone in every one of our patients, and we irrigate the ozone gas or the water, and it actually kills bacteria, viruses, and fungus. Every tooth that we fill to decrease sensitivity for our patients. So many patients complain when they get a composite filling that their teeth are more sensitive. And the process that we've developed using a soft laser, which helps to increase circulation in the tooth, but also we ozonate the tooth, and that helps to calcify the tooth before we fill it, because it sterilizes it, and then they have no sensitivity after the filling is done. We have certain products that we use for ourselves that we recommend our patients use. We've developed our own toothpaste that's free of fluoride. It has xylitol in it, which is a healthy sugar. It's got other ingredients that actually help increase the pH of the mouth and thus make the teeth stronger. So yes, we have all specialists here who can put in implants, but we like zirconium implants, which are non-metal implants. We can do crowns, and we can do smile makeovers, which is great. We can whiten your teeth, which is great. But you know what? Let's really get down to the basics. You want to be healthier. You want to live a healthy lifestyle. You're doing all this great work at home for yourself, for the rest of your body. Well, believe it or not, you have to start applying it to your mouth. And that's what we do here. So if you're coming in for a tooth checkup or a checkup, great. But expect a lot more. There's only one way, a better way. And that's what we're all about at Dentistry for Health New York.
I run the hygiene department, and I do a lot of non-surgical periodontal therapy. I also do thermography, and that's with Thermography for Health New York. I practice body talk, which is a form of energy medicine. And I do nutritional evaluations by Zyto, which is another form of energy medicine. My goal with my patients is to get them to understand how important their mouth is and how important it is emotionally as well as physically and on a chemical level also. So building a relationship with your mouth is your first step. Your second step is to have your regular hygiene visits, and also to follow through with your home care, which I tailor specifically for each person. Gum disease is a danger because it affects the entire body. So you can have gum disease or periodontal disease, and it can be a chronic condition, and eventually it can affect your heart, your lungs, your pancreas. If you're pregnant, it can affect your baby. It can affect your joints, which is what we call arthritis, and it's also a precursor to diabetes and Alzheimer's disease. So there's all these other diseases that we can connect right back to your mouth. But there's other facets to periodontal disease, which is nutrition and also emotions and stress. With PerioCare, what we see is that many patients come to us for a second opinion or an option out of surgery. And one of the first things we do is we test the pathogens. We test to see if they have bad bugs, right? Bad bacteria. Because if they don't, then we know that we have to approach it differently. And they definitely don't need surgery if they're not infected. Thermography is a tool. It's actually a camera that measures your body's heat. And you can locate neuropathies, heart disease, lung disease, tumors, carotid artery blockages. You can look at immune system deficiencies. But the biggest thing is you can see inflammation. And inflammation is huge when it comes to disease and healing and chronic illness. So there's a whole list of things that it can see. Those are just a few. I think it's a standard test everyone should have once a year. It's like getting a physical. It's a good idea to look in your body and see what you can't feel. And that's the beauty of thermography. You can't feel it, it doesn't mean it's not there. Typically someone will come in and their concern is that they want to be on a supplement program that is tailored for them, that works for them. Because so often people will just take random supplements because they've heard that it's good for them. Well, with this scan, it's called LSA. This scan sends out digital frequencies to the body, which basically asks the question, where are the weaknesses in the body? And the weaknesses will be found through their organs, their glands, their vertebrae, their nervous system, and their emotions. And the response that the hand gives back to the system will tell me what supplements are going to help get them healthy again. So, Robert, this scan is going to scan all of your teeth, the emotions that could possibly be keeping you from healing, and also the dental bugs that we hold in the roots of our teeth and in the bone. So I'm going to have you place your hand on this cradle. As you can see, this is starting to scan every tooth in your mouth. And the software is sending a digital frequency to your hand asking which tooth needs some healing or which tooth is weak. And even though it's scanning your tooth, it's also looking at your entire body, because every tooth in your mouth is connected to an organ, an endocrine, a vertebrae, a joint, and an emotion. We have these meridians that run through our body that connect our teeth to everything. And the exciting thing for me, because I work in the mouth, is that our teeth are one of the major energy centers for these organs and body parts. So if there's a interruption in the tooth frequency, it's quite possibly going to have an interruption down the entire meridian line. It will then find things that can help make you stronger and balance you. And it's going to look for homeopathic remedies. It's going to look at actual dental problems. And then it's going to find an affirmation statement. It's going to find a color, because color is healing. And it's going to find a flower remedy. And the flower remedy, the color, and the statement are going to work on your emotional and mental well-being. And we'll imprint that into a remedy that you take every day, so that that color, that flower, and that statement will work inside the body. As frequencies change, it'll help strengthen you. So that healing, the gums and the teeth, and actually the rest of your body, will all happen on many levels. Not just structure, but also chemistry and emotion.
Wow.
Now it's scanning a dosage, so that any remedy that it chooses, it will automatically dose.
No, it's amazingly accurate, though. The many things that you said, they really apply to me.
Good. So, Robert, what we're going to do is we're going to imprint your affirmation statement, your flower, and the color lemon green into this homeopathic remedy.
Okay.
So we're going to place it in front of this tower, and these frequencies are going to go into this remedy, and you're going to start taking it twice a day, just dropping it under your tongue.
Okay.
Body Talk is a form of energy medicine, and it's based on the theory that your body knows how to heal itself. It has an innate wisdom, and once things in the body are communicating and talking to one another, your body will know how to heal. And it happens with a hatha yoga technique through tapping, where as I work on the client, I tap the top of their head, and this links the right and left brain, so that now the brain has the ability to scan the body as we do the energy work. And then we tap on the heart. And the heart is actually the memory of the entire body. Most people think that your brain remembers. Your brain only remembers pictures and images and puts them together, but your heart remembers everything, right down to the words and the emotions and the tones of what you've experienced in your life. So once you tap on your head and then tap on your heart, your body locks in the frequencies that we're working with, and healing starts. Another good way to use body talk is with agenda sessions, and I most frequently use them for people who do public speaking, especially if they're nervous and can't stand to do it. Body talk centers you, gets you prepared, opens the vocal cords, and allows things to flow through you freely during your speaking. And also for athletes, professional athletes, they need it for high performance and also for recovery. And surgeries, people who are going into surgeries or even giving birth. Anything that requires the body to go into a certain frame of mind or form physically, you can do an agenda session to tune you up and get you ready for.
The mercury filling thing for me was huge, to have them removed. To be working with a alternative holistic dentist for me was really a wonderful thing. Meeting Tammy and just becoming so much more secure in the way to take care of my mouth, all the details of home care. Also, it became fun. It was part of loving myself, practicing the different things that they suggested for me to do with I think it's called the hydrofloss, the water pick type thing. We would do the slides for bacteria, just contributing to my overall health and wanting to take better care of myself. When I leave Body Talk, it's almost sometimes I feel a little bit euphoric. I mean, it's like something's been released, and I think about the things that Tammy and I talked about in Body Talk, and it just gives me reassurance. It really contributes so much to everyday living for me. It's just so cutting edge. It's so everything, so progressive. I just love it. I mean, I can't tell you the improvement in my health. I didn't make the greatest lifestyle choices when I was young, and I've really been making up for it now.
Yeah.
All the processes and all the education that I've established for myself and my own wellness, it's the same that you need for yourself and your dental patients. I've been doing this for I don't know how many years. How many holes do you need to learn how to drill? You know, you go to dental school, you learn your basics, they tell you about nutrition, I think in 2 days, and that's it. And the rest is really on putting in a filling, what's the best technique, what's the best materials. This practice is way beyond that. I probably go away once or twice a month, either speaking about our sustainable dentistry practice or learning more from other doctors and wellness providers about how the lack of vitamin D affects our bones, how the best way to get vitamin D is, or the effect that iodine has on our overall health if we don't have enough iodine, and how iodine is actually needed to keep your teeth strong. So there are so many ways that we are learning, even today, to up the ante, to make our patients even healthier, because there are so many innovations coming out. You know, they have studies showing that you can get Alzheimer's disease if you have an infection in your mouth, or if you have an infection in the rest of the body. So now we're learning what we can do about helping to get rid of this infection even quicker and faster for our patients. Through our research, we're very picky. You know, listen, I've been near death in the past. I know what it is to stay alive. I know what it is to be healthy. So the same things I do for myself, I'm going to do for my patients and my family. And that's what I do. And we don't cut corners. Everything has a specific purpose, and we don't like to say, well, that's okay. It's not okay. There's only one way, a better way. And that's what we're all about at Dentistry for Health New York.